Now let's move on to the treatment options available for the treatment of the condition known as the tetanus. In this, we will discuss the antibiotics we can use for the treatment of the tetanus and also antitoxins against the toxins, because the symptoms which are mainly, or the complications which are associated with tetanus are because of the neurotoxin, exotoxin that reaches the nervous system and attack on the neurons and cause all the complications or all the presentations associated with the tetanus. Then we go over how we can treat the spasm of the tetanus and also treatment of complications and severe tetanus. Treatment: entry wound should be identified, cleaned and debrided of necrotic material. The entry wound, the wound which is if there is abrasion of the skin, laceration of the skin, usually there is entry of the clostridium tetani at the site of the wound. So site of the wound should be identified and it should be properly cleaned and treated. Metronidazole 400 milligram rectally or 500 milligram IV every 6 hours for 7 days preferred. So metronidazole is used, which can be rectally or intravenously. Every 6 hours should be given for 7 days. Penicillin is the other drug which is used 100,000 to 200,000 international unit per kilogram per day. Failure to remove pockets of ongoing infection may result in recurrent or prolonged tetanus. So, if we should not remove or failure to remove the pockets of infection where the microorganism is growing and multiplying, those are the pockets of infection. If we should not remove or we fail to remove that, there might be prolonged tetanus. So metronidazole, penicillin are the two antibiotics that can be used. Antitoxin to deactivate any tetanus toxin that is present, prevent its uptake into the nervous system. Human tetanus immunoglobulin, preparation of choice, less likely to be associated with anaphylactoid reaction. Recommended therapy of immune globulin is 3,000 to 5,000 as single intramuscular dose, a portion of which should be injected around the wound. So antitoxin, human tetanus immune globulin is the recommended therapy of the choice, preparation of the choice, and it should be given intramuscularly in the muscle as a single dose or around the wound, which is the entry site of the microorganism, 3,000 to 5,000 international units. Equine antitoxin used in low-income countries, 10,000 to 20,000 units intramuscularly as a single dose or as divided dose after testing for hypersensitivity. So this is the two antitoxins that can be used. One is human tetanus immune globulin and the other one is equine antitoxin, which is used in the low income countries, which is less expensive. Benzodiazepines, it causes the control of the spasm of the muscle. Chlorpromazine and phenobarbital. Both of these are the benzodiazepines and they can cause the muscle spasm, cause relaxation of the muscles. Intravenous magnesium sulfate as a muscle relaxant also can be used. Cause respiratory depression. Best controlled with combination of sedatives or magnesium. Relatively short-acting, cardiovascularly inert, non-depolarizing neuromuscular blocking agents. Infusions of propofol. So all these are different benzodiazepines we can try. Some of these can cause respiratory distress. So the best combination is the use of magnesium and sedatives. Severe tetanus, how we can treat the severe tetanus. We already talked about the classification of mild, moderate, severe, very severe, extreme severe. In the severe tetanus, there is a spasm of the muscle, very bad respiratory distress, and it can be fatal because of respiratory failure and different other complications associated with the muscle spasm. So how we can treat that? Establish a secure airway. Because of respiratory obstruction, the severe spasm of the breathing muscles, there can be death, and the proper early opening of the airway is the main feature that we should do for this therapy. So establish a secure airway early. Patient should be nursed in calm, quiet environment. Light and noise can trigger these spasms, so it should be quiet environment. Endotracheal intubation is difficult in this situation because of the spasm of the muscle. There is all the facial muscles are rigid, and we cannot put the endotracheal tube easily, so that's hard to do. Ventilator support for several weeks is recommended. Here, if you see, there is the mouth, then we have larynx, trachea, and tracheostomy tube is placed in because endotracheal intubation is hard. Tracheostomy should be done in which the opening is created and the tube is put inside the trachea to open the airway and for the breathing. Cardiovascular instability, difficult to treat. Rapid fluctuation in blood pressure and heart rate are present. So it's very difficult to treat. When the patient reaches this condition, when there is cardiovascular instability, when there is respiratory instability, usually the mortality rate is very high. Patient needs to be on tracheostomy for several weeks. Improving by increasing sedation with the IV magnesium sulfate, morphine, other sedatives, esmolol, calcium antagonist, inotropes, and long-acting beta antagonist. All these are the treatments that can be used to improve the condition. The complications of tetanus, thrombophlebitis associated with the diazepam injection, ventilator-associated pneumonia. So all these are the complications basically of the different treatments that are used for the tetanus. If we use the diazepam, it can cause thrombophlebitis. Too long pneumonia can occur if the ventilator is in for a long period of time. Central line infections can occur. Septicemia also is common. So that was all about section 4. Thank you for watching sqadia.com.